Hi everybody, Dr. Kambeitz here at Kambeitz Chiropractic. So what I'm going to do is take you on a little tour of our clinic here and show you around. So this is front desk, and these are two computers here where people come into our clinic and they'll check in. So we're going to go on a little tour of the clinic and show you around. When people come in, we show them the 8 weeks to wellness wall. So this is kind of the pinnacle of what we do in our clinic here. So we do blood work, we do pre and post pictures, we check range of motion for people, so it's a really good functional assessment of what's going on in their body. And now with 5 years, we've had over 80 people go through the program, and we can honestly say that everybody gets success through the program when you follow these principles. So that's a big part of our clinic here. We treat a lot of professional, amateur athletes, youth athletes, everyone from babies to 95 is our oldest patient. So when we go back here, this is our therapy bay area, and what we do here is we do myotherapy. So myo means muscle. We also do AIS, active isolated stretching, where we do stretching and range of motion for people and just try to enhance overall function. So whatever ailments going on for people, they'll come back in here, and this is where we'll work the soft tissue, the muscles, the adhesions, and get their body functioning a lot better. We have two different massage rooms in here. So we have different types of massage that's offered in here, and two different massage rooms. So back in the gym, we have change rooms, men's and women's change rooms in here, and in the gym we have a lot of functional modalities and things like that. So we really look to increase function for people, so really training athletes to people that have never worked out, that want to work out and start working out. So it's a great kind of non-intimidating gym that we have in here. So we're going to go on back and show you the back of the clinic here, where we do a lot of our exams and treatment. Here you'll notice at the front too, we do a lot of nutritional supplements. So a lot of things people will come in with may have pain and inflammation, so we use fish oil, vitamin D, CoQ10, a lot of those different supplements, bars, sticks, a lot of whey protein, good drinks to take as supplements, the ultra meal we use for snacks in our 8 weeks to wellness program. And when patients come in, they'll get a number 1 through 6, and then when they come in, they'll have a dressing room, their very own dressing room, where they'll come in, and that way they can leave their personal belongings in here, make sure they take belt off and everything out of their pockets, and that way when they come into the adjusting room, it's much easier flow, and then when they're done getting adjusted, then there's a mirror and everything here, and they can just make sure that they grab their belongings on the way out. So back in here, as we go down the hall, this is our exam room, and here we'll do everything from taking digital x-rays. We'll do what we call a scan to see how their muscle and nervous system are functioning. We'll do a BIA, which measures everything from percent body fat to their phase angle, which tells us cellular health, to how hydrated their bodies are. So this is where we'll do a lot of the exam part. We'll do foot levelers, orthotics. So if people need orthotics, we'll do all that back in this room here. So back in this room here is one of our adjusting rooms. So we have two different adjusting rooms. So what we'll do, depending on if people have been adjusted before, if they want to do a manual adjustment, if they want to do instrument adjustment, whatever they want to do, we can accommodate them. So sometimes people have never been adjusted before, and they don't really know what to expect. So we'll just use a light instrument that just taps, very light for people. And this is great for kids and elderly that may want to just get started with adjusting. So we'll adjust with those, with that instrument. And sometimes people are really tight and restricted. So what we'll do is we'll use this instrument where it taps real light, and we'll work through their range of motion for them. So this is a great way that we can adjust people. Adjusting is obviously very safe, very effective, and we get great results with whatever we do, whether it's the instrument adjusting, or sometimes we use our hand, what I call manual adjusting, and we get great results with that also. So back in this room here, we do laser therapy. So we use a class 4 laser, and we also have Orconia cold laser. And laser therapy is something great to use on any kind of chronic problems, a lot of acute problems. And the best thing about it goes down to the cellular level and really helps regenerate the cells and get that joint or that area moving much better. So we use this quite a bit with patients also to accelerate the healing process.